Julie, and good morning, everybody. I'm Michelle Roberts, and I lead the state's COVID-19 vaccine planning and distribution team. I want to start today with sharing some good news. Vaccination rates are rising. Since the middle of August, we've seen a 25% increase in the number of people who have initiated vaccine in our state. This is fantastic news. More than 4.9 million people in Washington have received at least one dose of COVID-19 vaccine. That's more than 6% of the state's eligible population. And other good news is that nearly 70% of people 12 and older are fully vaccinated. We're closing the gap. Across the state, the number of eligible unvaccinated people is down to about 1.5 million people. If you're one of these people, what are you waiting for? Getting vaccinated protects you, your family and friends, and your community. Head to our vaccine locator website and make your appointment to get vaccinated today. Additional good news is that when we update the state's vaccine dashboard later today, we will report that the 9 millionth dose of COVID-19 vaccine has been given in Washington state. Thank you to all the Washingtonians who've had made the choice to get vaccinated and do your part to help our state fight this pandemic. I now want to move on to Pfizer vaccine booster doses. Pfizer vaccine booster doses are now available for certain groups of people who've completed their Pfizer vaccination series 6 months ago or more. The FDA and CDC recommend some people should receive a booster dose. And those groups are people who are age 65 and older, people of any age who live in a long-term care setting, or people who are 50 to 64 years of age who have an underlying medical condition. People age 18 and older may receive a booster dose if they have underlying medical conditions or if they're higher risk for COVID-19 exposure or transmission because of where they work or if they're in an institutional setting. We know COVID-19 vaccines are highly effective at preventing severe illness, hospitalization, and death, even against the Delta variant. But as the disease evolves, booster doses can further protect people. At this time, recommendations have not been made for people who received the Moderna or Johnson & Johnson vaccines. More information could be available in the coming weeks. I also want to clarify the difference between booster doses and third doses because they are not the same thing. A booster dose is given to someone who's completed the vaccine series and developed a good response. A third dose is an additional dose given to certain immunocompromised people who did not adequately develop immunities with the initial 2-dose series of Pfizer or Moderna vaccine. Now I want to give you an update on COVID-19 vaccines for kids under 12. It's one of the most common questions we are getting, especially with our youth back in school. Parents want to know, when can I protect my child under age 12? While I wish I had more to share, we're still waiting on information from the FDA and CDC, which we hope comes soon. Right now, students 12 to 17 are eligible for the Pfizer vaccine, and combined, about 48% of those teens or preteens and teens aged 12 to 17 are fully vaccinated. Let's protect our kids and keep them in the classroom by getting them vaccinated today. Vaccine supply isn't a concern like it was in the past. There's still plenty of vaccine available for everybody across the state, including more than 57,000 doses of the Johnson & Johnson vaccine. We know that's really important about where to get the J&J vaccine as we approach the October 4th deadline to be vaccinated for all the groups of people who are covered under the governor's COVID-19 vaccine requirement. Making an appointment is easy. Visit the state's vaccine locator website or vaccines.gov. You can even search for specific vaccine types, like the single-dose J&J vaccine. You can also find locations near you by texting your zip code to GetVax 438-829 or call the COVID-19 hotline at 833-VAX-HELP. And don't forget, you can get the COVID-19 vaccine on the same day as you get other vaccines, like your annual flu shot. We are recommending that you get your flu vaccination before the end of October. COVID-19 vaccines are safe and proven effective. They can protect you from getting sick and spreading the virus to others. Across the country, more than 200 million people have received at least one dose of COVID-19 vaccine. The more people are vaccinated, the better off we all are. If you have questions, visit DOH's Frequently Asked Questions page or talk to your trusted healthcare provider about the vaccine. Thank you.
Thank you, Michelle. Next, we will go to Lacey Fehrenbach. Lacey?
Good morning, everyone. Thank you for joining. I am Lacey Fehrenbach, the Deputy Secretary for COVID-19 Response at the Washington State Department of Health. Glad that you were able to join us this morning. I'm going to give a quick update on where we are in terms of data and trends for COVID-19 in our state. Overall, most of our trends are starting to show a decline, and that is very welcome and hopeful news. However, I want to be really clear that disease remains very high in Washington state. Our case rates, as you can see in the top of the graph, are starting to decline. We are seeing this trend statewide, and we're seeing flattening or declines in most Washington counties and across most age groups. However, disease does remain very high, as you can see, compared to our winter levels. We're just now coming below those peaks. Our 7-day rolling average for cases is 2,790, and that correlates to a case rate of about 579 cases per 100,000 population in a 14-day period. So pretty significant. Our hospital admission rates are also declining, but remain very high, much higher than we saw in the winter surge back in December timeframe. We are also seeing declines among all age groups here, except for pediatric patients ages 0 to 19. Those trends are flattening, so we hope that we will see them turn downward in the future, but we're not quite there yet. Our current 7-day rolling average for admissions is about 150 compared to 105 to 115 in that high plateau that you saw in the third wave. So that gives you some context about how much progress we still have to make in order to get disease rates low. Our hospitalization rate is 13.7 per 100,000 over 7 days. These are new admissions each day, and many people with COVID-19 stay for multiple days. So this means that hospital occupancy and ICU occupancy are still very stressed and high, those showing some slight signs of improvement. I want to also note that our state has passed a very somber milestone earlier in the week. We have more than 7,500 Washington residents that have lost their lives to COVID-19 since the start of the pandemic. And each one of these people, their life is a tragic loss to their death is a tragic loss to their family and community, and we mourn all of them. Unfortunately, we are seeing increases in COVID-19 deaths during this 5th wave. Our death data take longer to come in and be considered complete. As of late August, our 7-day rolling average for deaths was 35, and that compares to a peak of 41 in December. Trends in deaths typically lag behind cases and hospitalizations, so we'll be monitoring these data closely in the weeks to come. In the meantime, it's critical that we keep using all of the measures we know work to prevent disease and slow the spread of COVID-19. Vaccines are extraordinarily protective against severe disease and death. Unvaccinated 12 to 34-year-olds in Washington are 26 more times likely to be hospitalized with COVID-19 compared to similar aged people who are fully vaccinated. For people 35 to 64, if you are unvaccinated, you're 20 times more likely to be hospitalized compared to those who are fully vaccinated. And for people who are 65 and older, you're 10 times more likely to be hospitalized with COVID-19 compared to a fully vaccinated individual. By getting more people vaccinated, wearing our masks, and avoiding large gatherings, we can save more lives in the days, weeks, and months to come. We can also help protect our healthcare system for those who need it, whether that's for COVID care or other critical health needs. And we can help keep our children and staff safer in schools and childcare settings. There are hopeful signs in our data, but we are still in a very, very tenuous situation statewide. Let's keep working together to protect our families and communities from COVID-19. Back to you,